At ImageWorks, we have helped so many dental practices bring cone beam imaging into their office. One of the things we've noticed is that sometimes the staff is seeing anatomy that they're not used to seeing. As a result of this, we thought we'd create a short video that actually walks through the slices of a cone beam scan and actually points out some significant anatomy. We'll start by walking through the slices in the coronal view. So we're going to look at the coronal view starting at the posterior of the patient, and we're actually going to walk through the slices in the anterior direction. So in a similar manner to looking at a panoramic x-ray, the left-hand side of the screen is the right-hand side of the patient. So of course we start out seeing the spine and pointing out a few notable items like the dens of the C2 vertebrae and the C3 vertebrae. As we travel further, we start to see the condyles of the mandible, and we see the anterior arch of the atlas or the C1 vertebrae. As we continue on moving through the slices, we start to see the zygoma and we see the pterygoid plate. And then all the way at the bottom, we see the hyoid bone. We also see the hard palate, the maxillary sinus, and superior orbital fissure. We continue to see the zygoma. We now see the septum, the inferior nasal concha, and the inferior alveolar nerve canal. Now that we've walked through all the slices in the sagittal view, we'll now do the same thing in the axial view. With this view, we are looking toward the superior of the patient. In other words, it's as if we were at the patient's feet looking up towards the head. In examining the slices, we're starting at the top of the volume and migrating inferiorly through the volume. As we scroll down through the volume, we see the auditory canal, the septum, and the maxillary sinus. We see the zygoma, and we start to see the condyles of the mandible. And then we see the foramen magnum at the base of the skull. We then see the atlas, and then we see the C2 vertebra. Finally, toward the bottom of the volume, we can catch a glimpse of the epiglottis, and we see the hyoid bone. So we hope you found this little overview useful. Of course, if you have any questions at all, please don't hesitate to reach out.